Are you enjoying the Mindset Playground? Well, visit my website at louannehunt.ca. That's louannehunt.ca and join the Insiders Club and be the first to know about all of the upcoming podcasts, the guests on my show, some tips and tricks on how to live a great life from the inside out, and of course, the Clarity Keys method, which is coming up in October. I can't wait to see you there. Sign up today. Welcome to the Mindset Playground, and I'm your host, LouAnne Hunt. And I'm so excited that you're here today because you're going to get a dose of positivity. So today I have such a fun guest on the playground. She's taken time out of her very busy schedule to come and play with me on the Mindset Playground. And we've been doing a couple of projects together, and wow, this person is literally amazing me. So I can't wait for you to meet her. Julie, welcome to the Mindset Playground. How are you doing today?
Thank you so much. I'm doing great and happy to be here.
Well, I know that we kind of share a journey. We're putting together some programs because we know that there's a lot of things out there that have to get out as far as information and mindset programs. And yours is about mindset as well in a roundabout way, but might cover a little different topic, but it's still the same. So let's talk a little bit about who you are and what your program's about, and then we'll kind of back up and we'll go from there.
Yeah, thank you. So, my mom, when I was a teenager, said, "Why don't you be a nurse?" Because she had always wanted to be a nurse. And I just was like, okay, seemed like a good fit back then. So, currently, I've been a nurse for 46 years. Pardon me. Yeah, it's been a journey. So, I started out working on the medical surgical floors, and then I went to the ICU, and then I went to the trauma centers. And that's what I loved about nursing is you could do so many different things in the profession. And then I spent my last 10 years with patients on the helicopter, so transporting people that were in accidents on the freeway or that were at small clinics outside of Vegas that were too far to drive on an ambulance. And then in 2009, I was ready for another change and decided I was going to go teach nursing students. So I went to the university and started out teaching clinicals, taking the students to the hospital and teaching them what I knew and what I learned. And then I wanted to do more than that. I wanted to teach in the classroom. And then I decided I wanted to run the school. So on my journey of getting my master's degree and then my doctoral degree was my thesis of studying patient safety. Little did I know where it would lead me to where I am today. But LouAnne, I was already a nurse for 30 years and did not know that patient safety was such a huge problem. We think of hospitals as being really safe and where we're going to go in and get healed. But I found that medical mistakes were the third leading cause of death, right behind heart disease and cancer.
Wow.
So, yes.
Wow. So we'll continue that in 1 second, but let's back up to when you were going to nursing school because you know your mom said, "Well, why don't you be a nurse?" So, what was your mindset at the time? What did you think? You were just like going to go learn how to, like serve trays and that type of thing? Like what was your mindset at that time? What were you going for?
I thought it would be a really good profession because back then, that was the late 70s. It was like be a flight attendant. We called them stewardesses back then, be a teacher or be a nurse. And so I thought, well, nursing sounds interesting. I had no idea the depth of what that would include, but I found out on my journey. But I've loved it every step of the way.
Was there one thing in particular that definitely shifted your whole belief system?
I was taking care, my first job was taking care of patients on the oncology floor. And what I learned was those were the patients that really needed some TLC, a smile, holding their hand. It was one thing to change their dressings and hang their IVs, but they really needed that personal touch. And it really opened my heart to what truly nursing should be about, is that compassion for another human being. So that was pretty pivotal.
Is that what you think maybe might be happening nowadays? Is that everything has become a little more or too much, I should say, where they're just doing their job, they're
Yes.
collecting their paycheck, you know?
Yeah, there is a lot of healthcare burnout, not just nurses. And I think it exacerbated during COVID, and it really truly hasn't fully recovered. But I think the other big contributor to the nursing burnout, and that's psychological as well as physical, is the staffing ratios are so high, how many patients a nurse takes care of. And while the staffing ratios might not have changed a ton, they definitely have changed. But what's become more challenging is any patient in the hospital, the acuity, they're just really sick. They send home patients nowadays the night after a hip surgery or whatever. Whereas before, we used to keep them for 3 or 4 days so we could have a balance. But it's really interesting you should ask that question. I've been thinking a lot about how do we, with nursing students, with nurses, how do we help healthcare come back to the heart of healthcare? And because the pace is so frenetic, I've got to hang these medications, I've got to change this dressing, I've got a new admit coming from the ER. It is really a crazy pace. And so there's very little time left for that personal touch, it seems. But I think that's where we're missing the connection. I read a post on Facebook last night that just made me cry. And I decided I need to do a social post on this too. But it was a doctor who talked about going into a patient's room, listening to his lungs, adjusting his medications. And the doctor or the patient said, he points to a picture on the nightstand that's him and his wife when they were younger, and wanted to share that with the doctor. And the doctor, of course, is on his own. I got to get this done, get out of here. I got more patients to see. And he said over his shoulder, I'll be back later. Well, when he came back later, it was to do CPR on this patient because he'd coded and died, and they didn't revive him. And he's looking over at that picture and he's like, I missed an opportunity because I was in such a hurry. So he decided to change his patterns of behavior because it really hurt his heart that he had not taken that opportunity. And he got a little notebook, and the next day he says to a patient who was in there with pneumonia, a little frail lady, Mrs. J, can you tell me one thing about you that I won't find in your chart? And she looked surprised and said, yeah, I was a school teacher and I love teaching the students. And then the next patient, he said, can you tell me one thing about you that I won't find? Yeah, I drove a cab in New York City for 40 years, and man, do I got stories. And it really brought the humanity back. Just that one question, and even just an answer. How long does that take?
Yeah. And don't you wish, well, I wish as a potential patient that I could say that to doctors, like, what is it that I don't know about you? Like,
Yeah,
yeah, I know. I've been very lucky because the doctors that I've had in my life, and believe me, my healthcare wasn't just a straight line. But anyway, I've been really lucky because I've been able to connect with them on a personal level. Like, oh, is that your nice car outside, or can I take it for a test drive, or like little things like that. And yeah,
makes a
so
difference.
it does. It really does. It helps you to connect with the doctor, you
Hmm.
know, or just asking. Here's one, and I'm sure you can relate to this. Just asking the doctor how they are.
Yeah,
I mean, how many people ask, like, say, how are you? And
yeah,
remember what the doctor said from the last time and say, oh, how was that trip that you took out west or whatever? You know what I mean?
yeah.
And I think it just shifts everything. Would you agree?
Yeah, absolutely. Back to the human connection. We're not
Yeah.
just, as a patient, we're not just a diagnosis. We're not just that lady in room 403B, you know, we have a whole life that matters to us.
Yeah, that's so true and so meaningful.
Mm.
So I know that you said that you went from being a nurse and that you basically changed your position and you moved up that um, not corporate ladder, but you changed positions and eventually you were training. And did you find that working with your student nurses that adding a little bit of the personal development touch really helped with your nurses so that they can look at things differently
Yeah.
than what's in a medical book?
Absolutely. There's so many times that I would try to model that behavior for the students when we came into the room to meet the patient and really give the warm and build rapport right off the bat. You know, I'm here to assess you. I'm here all day with you. And here's the plan of care that we're going to do. And really teaching, you know, students nowadays, they just seem to not be able to have that ease in communication because they're so used to everything being digital. You know, they'll text each other and they're in the same room, you know, with their
Yeah.
so I really believe that I could influence all the nurses. And I think I've taught over probably 10 or 11,000 nurses over my years. And I've hoped and I have seen, you know, when they communicate with me later, that they did really learn something that they used, that I taught them. And that always made me feel like that's the imprint or the influence that I wanted to leave. You know, so that started in 2009. And then when I kept doing more research, I thought, what can I do to help patients and their families? Because they're in the hospital room feeling powerless. They don't know the language that we speak. It is like a second language, medical jargon. And they're really lost when they're trying to support their family member. And so I thought, well, what can I do? And that's when I wrote my book for them. And I really just wanted to say, here are some things that you really should understand and should know before you go into the hospital. How to choose a hospital, because there is a safety score, you know, for each hospital here in the US. Is it an A, B, C, D, or F? F, they're failing in 32 categories of safety and quality. And so I really felt like it wasn't just my duty, but it was really my desire to share what I had learned from experience and from my education to really help patients and their families.
Wow. So, what is the name of your book?
Surviving your hospital stay.
That's a great name.
Yes.
And when did you write that?
2 years ago it came out. So it took me a couple years to put it together.
And
Yeah.
how did that go? How's it going?
You know, it's going well, but it sits on a shelf in Amazon, which is great, or on my website. But I just want more people to be aware of the problem because what I feel I provide is a solution.
Mhm.
So you don't need to be powerless. You can be an advocate in your own healthcare and your families, and you should be, which is why now I'm developing this app for patients and the families, taking those 19 chapters and creating 6 modules in a course. Again, just to disseminate the information so people know where to find, hey, how do I figure out the doctor just came in and I feel very dismissed? What can I do? So giving communication tools, scripts, etc., to help them feel empowered.
Wow, that's a great, great purpose. And I'm sure one that's very much needed. And just being armed with that education, before it before the subject even arises is just comforting to know. And I had explained to you that there was a situation when my mom was in the hospital and I had given her diabetes medication and I wasn't supposed to, but nobody told me that and I just felt very foolish and it still stays with me today, that I had done that. But if the nurse would have just said or the doctor this is what we're doing, because my mom was going into like a hallucination stage. And
Mhm.
I don't know if that was her diabetes or if it was something else. Maybe she was in so much pain that I don't know to this day, but I didn't know that that's what was going on. You know, she kept asking the nurse for a sandwich, and the nurse said, "Okay, yeah, we'll get you one and bring it to you." Well, why say that? Because, or why didn't she say to me afterwards, "Your mom's going to keep asking, and this is why we're not." You know what I mean?
Yes.
So, yeah.
That's a really good point that you brought up because one thing I found in my research was that communication breakdowns are responsible for 70% of patient harm events. So if we look at doctor to doctor, doctor to nurse, family to nurse, all of those people with the patient at the center and everyone caring for and caring about the patient, which is family and the healthcare team, we have to bridge that gap of communication and have open communication and sharing, because as you said, that would have prevented, what became an error, but you didn't know. And so when we do open that door and create that bridge of asking questions, and really demonstrating to the healthcare team that we are an active participant, we want to help. It's not to um, belittle them, demean them, or to try to take over. It is becoming a partner, and that's what I actually did my TEDx talk on, is creating that bridge between patients and their families and the healthcare team. We have to. That's, I think, one of the biggest ways that we can change the medical mistakes from happening is communication.
Well, that's wonderful. And is that the main reasons why you wrote the book and did your TEDx talk?
I did. I just feel like, the first way that we create change is to raise awareness. And medical errors, that's why I didn't know about it for so long, even being in the profession. They're kept silent. We don't have transparency. They sweep it under the proverbial rug when there's a mistake that happens. And I call it behind the Wizard of Oz curtain of healthcare.
Yeah.
What is behind there? And I understand we live in such a litigious society that hospitals don't want to get sued, so they don't tell people what happened. And they should. The moral and ethical stance, the right thing to do is to say, we had a mistake in your husband's surgery today. We accidentally, blah, blah. Here's what it's going to take. And, there's been so much research too on litigation that families will say, if they would have just said they were sorry, if they would have just communicated, I don't want to sue them for money, but I just want them to know how this impacted our family because they kept silent. And I had to find out by myself.
Right. It's almost like finding out on Facebook that, somebody in your family has, is in the hospital or something. Like that's just, it's crazy that,
Yeah.
when they just leave you out of it. And the thing is that you're right. There are patients that are not staying in the hospital like for any amount of time. I've had a couple of surgeries where I was sent home. I had one major foot surgery and I was sent home the next day. And with this, with my foot not being able to use it for like 6 weeks. And
Wow.
not that, I mean, I was prepared. Well, I thought I was prepared. I thought I was prepared, but I wasn't prepared. and, but yeah, I have to admit though, I probably was really glad that I was sent home because I want to be in my own surroundings, but you just don't know what you don't know.
That is so true.
Yeah. So I'm sure that having a conversation with somebody like you would have been very helpful before I went into the hospital. So anyway, let's talk about your TEDx talk because I watched it and I'm going to put the link below in the description in here so that others can go and watch it. At first, I have to be honest, Julie, I thought that because you're so smart and because you come across, like as very knowledgeable, I honestly thought that I wouldn't be able to understand it. Like I thought that it would be so technical, because you are so smart. and but it was a great talk. You just seemed to talk to me. You brought it down so that to a patient's level so that they could understand it and watch it. And I really appreciate you doing that because I think that that will definitely get out there. So tell us about your talk.
You know, I do provide three patient stories in the talk of harm, and unfortunately, there were poor outcomes. None of the patients survived the events in the hospital. And I do that because I think people really can relate to stories. And the purpose was to say, oh, if I ever find myself in this situation, if I don't speak up, then maybe there's going to be a poor outcome with my family member because it is intimidating to say to the doctor or the nurse, can you please reassess my husband? He doesn't look right to me. That is hard to do in our society because we don't have that open communication yet or that two-way communication. And so I wanted to provide patients and their families with examples, but also I was speaking to the healthcare team about how important it is to listen to patients and their families because you know your family member better than anyone. You know the nuances. Like when you said your mother started to get delirium, which was not normal for her. As a healthcare provider, sometimes we have this bias that just says, oh, well, she's however old, 80 years old. Of course, she's going to be confused, right? And that's not necessarily true. And if we can intervene early and say, oh, help me understand what is her usual state of mind or mental status, then we can say, okay, let's go through the list. Is it her blood sugar? Is it her oxygen levels? Is it her electrolytes that are imbalanced? What's her vital signs? And take that data and say, okay, here's what we think the problem is and get it addressed. That was the whole idea.
Yeah. And that would have been so helpful at that time, if somebody would have just said, well, this is what we're waiting for, or we're waiting on tests, and she has to be in a fasting state, which is going to cause her sugar to be erratic. Like I understand it now,
Yeah.
having going through a type 2 diabetes diagnosis. Now, I've never been diagnosed with type 1, but still, I watched my mother long enough, and just from living through type 2, I understand now what she was going through.
Yeah.
Plus, with the help of a lot of friends like you who do know what's going on, you were able to explain it to me. Would have been a lot better back then.
And,
So,
and that's what I say to people too. Don't wait till you're in the hospital. Prepare because we're all going to be patients someday. I hope not. We all do. But, things are going to come our way with ourselves or our family members. And I'd say become informed now, become educated now as best you can. And then you're in a much better position because if you try to learn something while you're in this state of high anxiety because, your dad just had surgery or your son just was in an accident, it's not really a good time to learn.
yeah, that's true. That's very true. So I think that that is the real reason why you're doing this whole program and this app so that you can educate people. And we're so lucky to have people like you that are going to do that. Because that's the other side of the whole mindset part of it, people like you said, people being reassured and just coping. It's the coping mechanisms. Yeah, that's great. Yeah. So what's next?
I'm going back to mindset. I've thought of since we talked, and this subject I think is so important. The mindset for me that had to shift to do what I call this, to be my opus, is that I do have the experience and I do have the education and I have the passion in my heart. And that has propelled me through the fear, is knowing that even if I just help save one life, it would be worth it. And that's already happened, which I'm so grateful. But I think the other piece of mindset is for patients and their families to shift to empowered. and just learning the simple tools of the cuss words, for example. I'm concerned, I'm uncomfortable, I'm scared, and this is a safety issue. Those words, when used with the healthcare team, can alert them to you're not just being worried, but you're concerned that something is really wrong. And it really is how we approach things. And I always say the mindset of curiosity, or if you can convey, hey, I'm just wondering why my dad looks so pale. I'm just wondering why my son's heart rate is over 120, and I know that's not normal. Can you help me understand that? I think is a great place for your mindset to be able to feel like you've got a voice because you do.
Yeah. And even as the patient, correct? Would you
Yes.
suggest the patient themselves learn the cuss words or the cuss word?
Yes, for sure, because you know your body better than anyone. And if you say, I'm not feeling right, I don't know what it is, my heart feels like it's racing, and don't blow it off as anxiety. It could be, but we always have to look at what could be causing, just like when somebody has chest pain, it could be from indigestion, it could be from they strained themselves playing football, but it also could be a heart attack. And so, as healthcare providers, we are supposed to rule out the most dangerous or life threatening reasons first, and then we go down. I just did a post the other day about a 42-year-old woman who died of a heart attack because women don't have usually the same classic presentations of a heart attack that men do. Now, all the studies were done years ago, decades ago, on men. So they have very similar crushing chest pain. There's an elephant on my chest, it's going down my arm. But women are more subtle signs of nausea, vomiting. They won't have necessarily the crushing chest pain. So a lot of times, they'll be told, well, it's not a heart attack, whatever. And the woman was in the ER for 4 hours and sent home, where her husband then called the ambulance not too long after that. And they brought her back to the ER and she died because she did have a heart attack, but they weren't taken seriously.
Wow. Yeah, that's really scary. So at the end of the day, we're very lucky that we have you. And I like the fact that you're trying to get the word out there to people. You're not just doing this just to sell books, you're really trying to get the word out there. And that's
Yes,
wonderful. That's really wonderful.
thank you.
We need more people like you, Julie.
It's interesting. One podcast host a while back said, do you not feel like you're throwing your profession under the bus? And by calling out the mistakes that are made, the errors that are made, I did another post a couple days, actually it was about a week ago, about a nurse giving the wrong dose of morphine. She gave 100 milligrams instead of 5 milligrams because she wasn't sure how to do the math and she thought she did it right. And of course, the patient died. And it's not about calling out that individual specifically. It's about the examples of the mistakes so that we can be on higher alert in the hospital. And a bunch of nurses wrote in and said, well, why didn't she ask somebody? So it brings the awareness to them too, not to skip the safety steps when giving medications. There's 5 or more rights, medication safety rights that we're supposed to do. And a lot of times those get skipped because they're in a hurry. But when we skip some essentials like that, patients can be harmed or die.
Yeah, that's interesting. And sometimes I think we need to be reminded of those things as well because life becomes lifey, unfortunately.
It does.
And yeah, and you're busy, you want to get it done, you want to move on to the next patient. And like I get it. That's with all of us. Life gets lifey, like I said. And just taking a break for, 2 seconds could really mean the difference.
We have a lot of cognitive bias in healthcare. The first story in the TEDx talk about Lewis Blackman, I've told that story to so many nursing students because we talk about what a term called failure to rescue. which is failing to recognize the patient's signs of deterioration. And so Lewis's case, because he was a 15-year-old healthy boy that went through surgery just fine, it was afterwards that he started suffering the complications. But the bias was that he was healthy and surgery went fine. So his symptoms and signs of deterioration were missed because they just, again, had like these blinders on to recognize, wait, why is this kid's heart rate 126? And then it was 147. There were multiple clues telling the healthcare team, and of course his mother, something is wrong. Something is wrong with my son. And so that whole gap of communication is such a powerful reminder of not ignoring the subtle signs that then grow into much bigger ones. And I think, again, in healthcare, that bias can, just like the example, if your mother's 80 years old and she's confused, they're going to assume that's normal and it's not. So we have to communicate. We have to be a two-way communication to convey, like you said with your mom's story too, those little things that are actually big things.
Right. So what are the letters again, and what do they stand for? Because I know that's really important in your whole talk and also in your book. So let's talk about those letters again.
Cuss, concerned, uncomfortable, scared, and there's a safety issue or a safety situation. So, for example, I'm really concerned my husband is not acting like himself. I'm really uncomfortable with the amount of pain my son is having. It's in his abdomen, but he had chest surgery. I don't understand. I'm really scared something is wrong because my mom never talks like this or acts like this. She's just not herself. This is a safety situation. I see that my mom had knee surgery, but her foot is cold. Can you help me understand that? I think there's something going on here that we really need to reassess.
Oh, that's great. That's so helpful. And even for the patients themselves to remember CUSS when you're trying to explain to the doctor what's going on. So those are great words to know because, yeah, like I said, even when you're in the hospital by yourself, and, unfortunately, when I had my foot surgery, it was a major foot surgery and it was during COVID. So
Mm,
I wasn't allowed to have anybody in with me. So, I'm in there by myself. And
that's hard,
that's really tough.
scary.
Yeah.
Yeah. One other thing I'll share really quick with your audience is what I call the three Ps. It's
Okay.
be present. So, not just physically present when the doctors make rounds, if you can, or when the nurses change shifts, because a lot of communication is missed between patient handoffs. But be present in your heart too. Go in with a good intention that you're going to be a partner with the healthcare team and protect your loved one. And the second one is be polite. Even when we feel anxious and scared ourselves, be polite because that always goes, like my mom always used to say, you get more bees with honey than vinegar, right?
Yeah, that's so true. That's
Even though
very
sometimes
true.
it's challenging. And then the last P is be persistent. So if you feel something is wrong and you tell the bedside nurse and they don't take you seriously or you don't see any action or interventions, then you escalate. So there is a chain of command in the hospital. There's the bedside nurse and then the charge nurse who's in charge of the unit over all the patients. And then there's the house supervisor who's over all nursing of the hospital every shift. And then we have sometimes a patient advocate in the hospital or a risk management department. But there's also the attending physician you could try to get a hold of yourself if say, hey, something's wrong and they're just not listening to me. But the last in that chain of command is the administrator on call. So that's somebody from the C-suite, the chief executive officer, the chief nursing officer, one of those that are on call 24/7, nights, weekends, and holidays. That would be not my final step, but it would be. Um, I wouldn't go, I wouldn't be afraid to also threaten to call the news. If you know something is really wrong, in fact, I did a story not too long ago of a girl whose insurance company denied her spinal surgery. She was in intense pain. They had tried everything. The medical literature supported this surgery, and the insurance company denied until the news got a hold of it. And then it was approved. So I just say, if you know something's wrong, just keep going up the chain of command. Be persistent.
That's really good and professional,
Yes.
because be professional as well, because if you're
Mhm.
going to scream and carry on, then, everybody's going to just kind of walk away from you that, oh, well, she's just another one of those who's going to cause trouble. But if
Yep.
you're professional, you can't take anything to anyone complaining that the person was professional.
I love that. So let's make it the 4 Ps.
Yes. Yes, it's so true. We used to always say that, be professional, because how can you complain about somebody who's professional? Well, Your Honor, she said, "Good morning. Can I help you?" Right?
Yeah, it's so silly, but it's so true.
Yeah, you can't complain. You cannot complain at all about
Yeah.
professionalism.
Yeah.
And the other trick I learned is the tone of your voice. The
Yeah.
tone of your voice will get a lot more attention. So even if you are professional, think about the tone of your voice. So we'll have to come up
Good
with
one.
another P for that.
Yes.
Well, this has been a great conversation. Thank you so much. I've really enjoyed it. I can't wait to see everything that you're coming out with next as far as your app and your program. I'm very excited for you. And I
Thank
know
you.
we're kind of partners in that. So I'm really looking forward to working with you further on that. And yeah, who knows?
Me
Maybe one day
too.
we'll be, on one of these big talk shows, The View or something like that. There you
I
go.
love it.
But
I love
before
it. I
we
think
go, oh, go ahead.
I was just gonna say, we both have messages that are so important.
Absolutely. Yeah. And I'm not going to quit until my message is out there, because you
Me
never
too.
know. You never ever know, Julie, who's listening.
Yeah, I really feel like my whole career has brought me to my true purpose in life, and this is what it is. So there's nothing stopping me from even the challenges of trying to figure out, technology or distribution or all that stuff. It's just a step in the journey.
For sure. Remember, technology loves you and you love technology,
Yes.
as
Oh
I
my
keep
gosh.
saying.
Yes.
So before we go, I always ask my mindset guests for 3 golden nuggets to leave the audience with. So what would your 3 nuggets be?
I would say that understand and know your own power in advocacy. And all it takes is a little bit of education and a mindset to know that what you're doing is so important and it does make a difference. And I would say the other nugget is check out your hospital near you on hospitalsafetygrade.org if you're in the US and see what the hospital is rated. Because with the safety and quality indicators on that website, you can find out if it's an A or an F or somewhere in between, and your chances of harm occurring at a D or F rated hospital is 91% higher. So that's really essential to know and to figure out. I was talking to a girl the other day who's 7 months pregnant, looked up her hospital and saw that it was a C, but she found an A rated hospital just 30 minutes away. And she said she's changing where she's having her baby. So it does make a difference. It really does. And I'd say the last one is care about each other. Just show human compassion and kindness to everyone we come in contact with. We never know what they're going through. We never know what brought them to this place. Even if they're not nice, there's usually a reason. And if we can show compassion, sometimes that makes all the difference in that person's day and life.
Well, those are some great golden nuggets. Julie. And I thank you so much for being a guest on the Mindset Playground. And I look forward to playing with you again one day.
Thank you so much for having me. I hope your audience learned a thing or two.
Oh, I'm sure they did. And I'll put all the information on how to reach you, how to get in touch with you below this podcast. And good luck
Awesome.
to you.
Thank
Yeah.
you.
Thank you.